Truly, the last 3 months seem to have wiped out some of the earlier issues of the last 15 months, to tell you frankly. It was the last 3 months which has left scars on our minds far more than anything which has happened ever in our lives. And let me explain to you in simple terms, very briefly, that we last year were watching the horrific visuals from abroad, be it Italy, be it England, be it United States, where there were queues of ambulances waiting, there were queues of patients who were, and all wards were converted into COVID wards, and there was no cardiologist. Every cardiologist was looking after COVID abroad. Our government was passionate enough to bring down a lockdown much earlier so that we didn't see the worst of it. And we also unlocked slowly, very logically, so that we actually had a few small waves, but nothing like what the West had seen. So in fact, somewhat of a complacency came in. And when this wave came, we were ourselves surprised by the steepness of the infectivity and the rise, because we as doctors, as medical experts, and many virologists had not expected such a steep rise. And that is what took us totally by shock. In fact, I would say a shock rather than a surprise. In fact, very rapidly, as we started, like last year, started having meetings to ramp up our infrastructure, and the government directive started coming in, and we started diverting doctors and nurses from care of non-COVID patients to COVID patients, we realized that our meetings had to become every day, sometimes 3 times a day, because suddenly the surge in the emergencies and seriousness of the patients was far more than last time. Last year, we used to get patients who were even for isolation getting admitted saying, we want to stay here for 5 days because we only have COVID. And these were patients who had practically only sore throat and cough and fever, and they just get better and go home. This time, we started seeing patients coming in who were actually gasping, who were breathing. They were younger patients, and attending to them rapidly became the need of